I'm Melinda Kavanaugh, an associate professor at the University of Wisconsin in Milwaukee. And I'm here today to talk really briefly about some of the research and projects that I've been doing with the Wisconsin chapter, most of which stretch back about 7 years. And the first thing that I'm going to talk about is what you see here on your screen, which is the Y Care program, which I'm very, very proud of and very excited to have been able to develop here with the Wisconsin chapter, and probably quite a few of the families watching this video now. So what we've been able to do over the years is really kind of hone in this project, which looks at the types of care that youth, so typically kids and youth under the age of about 19, the types of care that they engage in to help take care of someone with ALS in their family. And this can be a parent, it can be a grandparent, but these are children and youth who are doing a lot of care. And for many years, they were doing care and kind of living in families with ALS without a lot of support or information or education. And so what we've been able to do with the Y Care program is develop a whole protocol that includes handbooks for kids. It includes training and educational materials for healthcare providers that creates a full day of not only skill training, so helping kids understand what's the best way to transfer someone, how do you help feed someone, what's a good food consistency, and should it be thick or thin, and what are some ways that they can get support in that care. And the way that we have developed this day-long program is through the engagement of multidisciplinary professionals through both the Wisconsin chapter and the ALS multidisciplinary clinic at Froedtert Hospital. So the Y Care program involves physical therapists, occupational therapists, speech language pathologists, social work, neurology, everybody really coming together to provide support, education, and skills for youth. And the exciting thing is that not only have we developed it and tested it here in Wisconsin, we've actually taken the Y Care program and we've done it in Washington, D.C. several times during the ALS advocacy days. We've done it in Colorado, we've done it in Utah, and we've done it in Massachusetts. And every single time we do it, we always engage the local chapter, we engage the local ALS multidisciplinary clinic, and we have so much data that very recently, both myself and here at the ALS multidisciplinary clinic, Drs. Barkhouse and Drs. Fee, we have published several papers that have looked at not only how kind of feasible it is to be able to do this day-long program with children and youth in families with ALS, but we've also been able to look at the data that we've collected over time. And the most powerful thing that we have found is that after kids participate in this Y Care program, their confidence in the skills and in the caregiving tasks really improves after being a part of the Y Care program. But also they feel more supported, because what happens in the Y Care program is that kids get to know other kids because they do it in peer groups. So what we do know from many years of research is that kids who are providing care to someone, regardless of what the disease is, they often feel really isolated and alone and have a hard time talking to their peers about it, because it's just not something that kids typically talk about or typically share. So young caregivers tend to be a more isolated group, but in the Y Care program, they are supported by other peers. They can talk about ALS or caregiving or transferring or gait belts in a very normal, easy way. They get to ask questions of professionals that maybe they would never have met, because a lot of people don't bring their children to the clinic or to the chapter for services. And so what Y-Care does is it gives these kids the opportunity to meet professionals and get to know them and know, what does a PT do? What does an OT do? And then they're doing that along with other peers so that they're getting the support, they're getting the education. And we spend a lot of time in the Y-Care program checking in. How are they doing? Is this working out for them? Are they feeling emotional? Do they want to talk to somebody? So we always have social workers present to make sure that we're really attending to those emotional needs. And then during lunch, which often is the highlight of most youth's day, they get to sit down with the neurologist and have lunch. And this is really exciting because most kids have never sat with and met a neurologist, much less one that they can answer questions about. Well, why is ALS doing this to my mom or dad? Or what is the progression like? Or what causes it? And the kids just absolutely love it. So we've had, we actually have 2 papers now published just on the Y-Care program. And then we also have a recent paper that was published in Neurology that covers the whole study of children and youth who provide care to a family member with ALS. And that was a study that was conducted several years ago across the country. And it really helped us kind of bolster the need for more programming and more support and more engagement with youth who are living in families with ALS. Because what we do know is, regardless of the disease, again, these are children and youth who are pretty well isolated. They don't have a lot of peers, and they need education about the disease itself. And they also are really struggling with their own well-being. And one of the ways we think about well-being is sleep. And we've been incredibly fortunate that about 1.5 years ago, we did a study with the Medical College of Wisconsin and the ALS chapter. And we did a pilot study where we got kids who were in families with ALS and other kids who are not in families with ALS and who do not do any caregiving. And we gave them a sleep device to kind of measure, are they tossing and turning? Are they sleeping soundly all night? Are they waking up to provide care? What's going on in their sleep? And when we looked at the data, we looked at the youth who were caregivers in ALS, and their sleep was much more disrupted. They were not only getting up in the night to provide care, but what was really happening is that they weren't sleeping soundly. And something that's important for us to be able to assess next is, why are they not sleeping soundly? Is it anxiety about care? Is it worry about school, or worrying about their person in their family who has ALS? So we're really excited that our next project is being able to look more in-depthly into that, not only just measuring are they sleeping and how often, but helping kids understand what are some of the ways that their sleep is being disrupted and why. And that's a whole new area of research in children and youth who are caregivers. Frankly, nobody else is looking at that. So it's incredibly exciting, but it's also really powerful that we're able to do that in not only in Wisconsin with our Wisconsin families, but really looking at it in the context of ALS. So the next thing that I want to say is we have a video on the website that is from a conference presentation that I gave, also from my living room during the time of COVID. But it was a presentation to the Netherlands ALS. And this was a group of about 250 professionals in the Netherlands who work in ALS, and they're across all health professionals. They were neurologists, social workers, physical therapists, you name it. And I was invited to give this presentation to kind of not only share the research that we've been doing here in the US, but just share broadly, what do we know about children and youth who provide care to somebody, but then also what do we know about children and youth who provide care to someone with ALS. And so we have uploaded that video. just to give you an even broader sense of some of the work that myself and my colleagues have been doing in this area. And if there's any questions or, any feedback, I know that this is all online and it's on a website, but please don't ever hesitate to, ask the Wisconsin chapter. They certainly know how to get in touch with me. They have my information, and I'm just so thrilled to be able to share all of this research and programming and continue to do everything I can to improve the lives of children and youth who are living in families with ALS. So thank you so much for watching this video, and I hope to be able to meet you in person soon. Thank you.